Hello, my name is Allison Warner, and I am the Chief Editor of Orthodontic Products. Thank you for joining us for today's episode of In the Sterilization Room with Jackie, where we talk to infection prevention expert Jackie Dorst about what you need to know to keep the orthodontic team and patients safe during the COVID-19 pandemic and beyond. For over 30 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She has degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Hi, Jackie. How are you doing?
Hi, Allison. I'm doing well. I think things are settling down a little bit during the pandemic, and we don't have quite as much new information coming out. There's always something, especially now CDC's giving new information for what vaccinated people can do and allowing a little bit more there, but there's always something new for us to talk about.
Yes. Well, in shortage news, that's something for us to talk about. We have a new one. I know before we've talked about mask shortages, we've talked about glove shortages. So with vaccinations roaring along, there is now a shortage of FDA cleared sharps disposal containers.
Yes.
Now, as I understand it, Jackie, orthodontic offices are not cycling through these containers that frequently, but they could get caught in it at some point, depending on when manufacturers can ramp up production. So what is an orthodontic practice to do?
Yes, you're right, Allison. Orthodontic offices, they don't give injections, so they don't have a lot of needles and syringes and carpules and all to dispose of in their sharps container. They mainly have arch wires, ligature ties, burrs. Those all go in. If they use maybe a barred Parker blade in the lab, then that would go into their sharps container also. So those type items, and again, that arch wire, and I want everybody to get the visual of when you do a debond procedure. And what a lot of orthodontic assistants will do is leave the arch wire in the mouth and use a plier to remove the bracket, a bracket removing plier, and they'll just clip all the way around the arch and then lift out the arch wire with all the brackets on it. Right. Well, that's an unusual shape. It's not a straight device or as small as a burr, so it takes a larger mouth on the sharps container to be able to slide that whole arch wire along with the brackets into the sharps container. So I know I've often recommended to my clients one of those sharps containers that has a large mouth on it, like a 2.5-inch wide mouth if it's a round sharps container, and then the ones that have the long slot that almost have a hinged door on them that you can drop that arch wire in. That's really the ideal for an orthodontic office. And again, because they're not putting those whole syringes like when we're getting our vaccination injections in the arm, that the orthodontic office doesn't fill these up as quickly. But they do fill up, with them, and they may have to buy a replacement sharps container during this period. And it's specific. Sharps containers are both cleared by the FDA, and OSHA says they should be red or orange, have the biohazard symbol on them, be puncture proof, spill proof, and be able to be permanently closed once they're filled. So there's specific requirements to be an approved sharps container with it, and they're readily available. You can buy sharps containers on Amazon. You can buy them from the different dental distributors. So normally there are multiple ones that are available. Right. And so the orthodontic office, let's hope that they don't have to buy a new one during this shortage time, but they need to be prepared in case they do. Right.
Yeah, exactly. So since the sharps in an orthodontic practice are unique, how do they usually manage them during the regular instrument flow?
Okay, so let's imagine now I'm treating a patient and I've had to replace the arch wire. The doctor wants a different size, whatever, and made the changes. Well, you may have tied in with a few ligature ties in the areas where you would need that versus putting on elastics, and then you have the old contaminated sharp arch wire that you've taken out that needs to be disposed of in a sharps container. And ideally, OSHA says that a sharps container should be as close as possible to the point of use. And I have seen a few orthodontic offices that either have a sharps container mounted on the side of the unit, and again, it's one of those with a long, wide slot on the top of it, or I've had a few that would even have a small sharps container recessed in the top of the treatment unit, the chairside unit, if you will.
Okay.
But that's rare.
Okay.
It's a unique situation. Sitting it out on the countertop, sitting a sharps container out on the countertop, say next to the hand washing station in the open bay area, it's just not a clean, efficient way to manage it. So
Okay.
most orthodontic offices will have their sharps container located in the sterilization room. And when they go to the sterilization room with their cassette of dirty instruments or their
Mhm.
tray of dirty instruments, then they have to have a way to transport those sharps
Right.
from the treatment chair.
Right.
And traditionally, for offices that were using the tray system, they put all of their arch wire clippings and arch wires and everything on the tray. Then they
Mhm.
go into the sterilization room. Well, now you've got to use a pair of cotton pliers to pick up each one of those off of the paper tray and delicately put those into the sharps container and not lose them.
Okay.
And they're small little sticky wires.
Mhm.
And out of frustration, I've seen many, many orthodontic assistants that just go, oh shucks, and they pick up the whole paper with the sharp still attached to it and put it in the regular trash.
Oh, okay.
Yeah, well, that becomes a safety risk because
Right.
now whoever's emptying the plastic trash bag, if it
Mhm.
has sharps in there, it could poke through
Right.
and you could have a stick or a poke. And now you've got to go through post-exposure evaluation protocol with it. So one of
Okay.
my recommendations over the years has been when you get ready to treat a patient, is to set out a patient cup, one of the paper or plastic cups off to the side. And then as you're treating the patient, all of those sharps can be placed in that patient cup.
Yeah.
And then when you're ready to clean up the unit, take your instruments into the sterilization room, you pick up the cassette or the tray along with the patient cup, go into
Mhm.
the sterilization room, and the cup can easily be turned upside down and all of the sharps can easily go into the sharps container.
Okay.
So it's a safe, clean way to transport those sharps if they need to into the sterilization room.
Okay.
And then once the sharps container is full, then they would safely dispose of it with their biohazardous waste disposal.
Okay. And then is there anything else they should know about this disposal of the sharps container itself?
Yeah, you can't just throw away the sharps container in the trash,
Yeah.
obviously. It is contaminated sharps, so
Yeah.
it does have to be appropriately disposed of with a biohazard waste company.
Okay.
And different states have different laws. It
Mhm.
comes under EPA, the Environmental Protection Agency, for biohazardous waste disposal and for sharps containers. So going to the EPA website will provide a link to each state's
Mhm.
sharps disposal or biohazardous waste disposal. So you need to
Okay.
be familiar with yours. And different states have different regulations. I live in Florida, and Florida has a specific regulation that says full sharps containers must be disposed of within 30 days.
Ah,
Not
okay.
all states have that. I know in Colorado, I went into one orthodontic office that a young orthodontist had purchased from a
Mhm.
doctor who'd been in practice for over 25 years,
Mhm.
and there were 30 full sharps containers
Oh, just sitting there.
just sitting there that they never had a biohazard waste pickup. And so now the young doctor was, what do I do with all of these? And normally, if you subscribe to a biohazardous waste service, many
Mhm.
of the companies will push to have a monthly or a
Mhm.
quarterly biohazardous waste pickup, but
Mhm.
orthodontic offices don't generate that
Mhm.
much.
Okay.
Now, so you really don't need that frequent of a pickup on it. So
Mhm.
frequently I've advised many of my clients that have a relationship with an oral surgeon or maybe a periodontist
Mhm.
that they generate a lot more sharps and maybe they're in the same professional building or
Yeah.
complex with them or the
Yeah.
same building. If you could add your full sharps container to theirs, then it
Okay.
would save you that biohazard waste pickup and you can treat them to donuts for a couple of days as a
Yeah.
thank you with it. So
Yeah.
yeah, so there are a number of alternatives to manage that.
Okay.
Someone on the team, the clinical team, should be responsible for looking at the sharps container to evaluate how full they are. Because
Mhm.
another thing is that when the sharps container gets to be about 2/3 or 3/4 full, then it should be closed, again, permanently closed,
Okay.
so that it's ready for the biohazard waste pickup and a new sharps container put out. You don't want to be in the middle of a busy day and it's your Devon day, and
Yeah.
you're making a party and you're singing songs and giving everybody their presents for their beautiful smiles and taking photographs, and the sharps container's full. There is a risk of, well, can I push this down, like you do with a trash can, and get
Yeah.
just no big safety
Okay.
risk there.
Okay.
So, you do need to have that on your routine checking, just like you do your regular spore test, just like you test your ultrasonic with the aluminum foil test. Then you need to be looking at the sharps container. When is it full? And be able to seal it and have a new one ready to replace it. Now,
Okay.
if you can't buy one, you're going to have to look at some of the substitutes.
Right. So if we
And
do get to a
yeah,
point where there's an actual shortage of these containers, because right now the orthodontic offices should be okay because they're not cycling through them as frequently as, a medical environment. But if we do get to that point, if the manufacturers can't catch up, what's the guidance from
well,
CDC?
CDC has provided a very great poster, and I think you can bring that up, and all orthodontic offices can print it out, and and this is an emergency use authorization from
Right.
FDA, from CDC, from OSHA, that we can emergency use, and they gave a number, four or five different types of alternative containers. One of them was like to use a household laundry detergent container that has been thoroughly rinsed to get out all of the residual chemicals in it. You need to put a biohazard symbol on it, because again, and you can print that out from Google Images and
Okay.
use that until you could get a new sharps container. And then another one might be a new paint bucket with a lid on it. Another one could be, they even listed on this, a gasoline container.
Yeah.
I was a little reserved about the new gasoline container because normally the spout or the opening on it is going to be too large for an arch wire to go through. It would be difficult for me to get an arch wire in there. So CDC offered a couple of alternatives for emergency use, just like when we had a glove shortage. We talked
Right.
about using utility gloves more in the sterilization room rather than using those exam gloves. And just like when we had a mask shortage,
Right.
we learned all of the different alternatives. So we're
Yeah.
still under this emergency use, but as the supply chain refills, the distributors have these available. If you do go to one of these alternatives, then you're going to need documentation of maybe 2 or 3 places that you've tried to purchase a sharps container and have been told that they were out of stock. So I would keep those as documentation during this time in case the OSHA inspectors showed up at your door.
Yeah.
And when they come through to inspect, they're going to look at everything and they go, why do you have this laundry detergent bottle for a sharps container? And you go, well, during the shortage, this is the best, our alternative for it until we could buy a sharps container. So another shortage for us, we went from toilet paper to mask to disinfectant wipes to gloves and now sharps containers.
Well, I think we're all becoming very hyper aware of the supply chain. So, and it does sound like the best place to go to kind of keep up on this stuff is the CDC. So they'll post another update if the sharps container shortage resolves. So
Yes.
just to keep an eye on that. So, okay.
CDC has been providing excellent updates, and useful documents is the one that you showed with the sharps containers on there. They're providing the resources as we emerge from this pandemic.
All right, Jackie, thank you so much for that. Check back soon for the next episode of In the Sterilization Room with Jackie. In the meantime, to catch up with past episodes or to check out the latest orthodontic industry news, visit our website, orthodonticproductsonline.com. Until next time, take care and stay safe.